Hey guys, in this video I am sharing my work and experiences in general surgery ward. Okay, let's get into the video. I am Sri, currently a PharmD intern. Now I know you all thinking how I am working in a general surgery, right? While already well with a little hustle, a lot of passion, I found my way into gaining real life experience ahead. Often what my role is crucial. I work alongside surgeon, anesthesia and nurse to manage medication before and after surgery, from preventing infection to handling pain management. We ensure patient recovery is as soon as possible. This is not just the last day of my general surgery rotation. This is the end of my very first clinical posting as a PharmD intern. And what an unforgettable journey it has been. I never expected it turned like this. I had very beautiful experience. Okay. On the very first day I walked into the general surgery ward with excitement, little bit of fear and a lot of questions. Everything was new, the environment, the responsibilities, but now as I prepared to say goodbye to this ward, I realized how much I have learned and how much I have grown. From emergency cases like trauma, acute appendicitis, to elective procedures like hernia repairs, each day brought something new. I never expect like that. As a PharmD student, I was not performing any surgeries, but my role was just as an important in the background. I observed, I learned, and I contributed whenever I could. One of my first responsibilities was medication reconciliation, reviewing patients' existing prescriptions, checking for potential interactions and ensuring surgical safety protocols were followed. The most eye-opening experiences for me was observing how tightly connected all departments are: surgeons, technicians, nurses and etc. I began to truly understand the term multidisciplinary team. I will never forget one patient case. A middle-aged man recovering from a laparotomy. I was involved in the counseling him and his family on post-discharge medications. The gratitude they showed me that even simple guidance can make a huge difference. One challenge I faced was understanding the pace of surgical unit. Its fast decisions are quick, accuracy is crucial, but the main motto and aim is to decrease the disease rate and increase the lifetime of the patient. Initially, I struggled to keep up with the surgical notes, medical abbreviations and documentation, but slowly with the help of seniors and supportive staff, I found my rhythm. The general surgery ward also taught me emotional strength. Not every case had a happy ending, right? There were some complications, there were losses, but with every challenge came a lesson in resilience and empathy. As healthcare professionals, we have to balance clinical skill with human kindness. In ward round participation, I learned so many things, from diseases and their symptoms and signs, how it will be diagnosed. Like, I listened to consultants explain the condition, the treatment plan and the prognosis. I learned about wound management, pain control, anticoagulant protocols, and Most importantly, communication. When we don't have any communication with others, we don't learn any or we don't gain anything. Communication is very important for everyone. For professionally, it will work. Okay, to gain something new. Every day is learning day, right? To gain knowledge, to learn something. So when I realized that learning does not just come from doctors, nurses taught me more than I ever expected. How to read main part of the case sheet and how to note that, how to check dressing techniques, how to talk to patients when they are in pain. Their compassion and multitasking ability were inspiring me a lot. I reflect on these past few weeks, I feel incredibly grateful for the patients who allowed me to learn, for their consultants. This rotation had laid the foundation for my clinical journey ahead. Today, I no longer feel like a student lost in the ward. I feel like a part of the healthcare team. It may still have much to learn, but I am no longer a complete beginner. As a PharmD intern, our main role is checking patients' prescriptions, like any in prescription have any drug interactions, like that. In main clinical side are like patient care. In patient care, medication counseling is the main part, to educate patient on medications, including proper uses, potential side effects and interactions. Monitor for ADR effects like adverse effects. Therapeutic drug monitoring, collaborative practice, interprofessional collaboration, medication therapy management. Communicate effectively with patients, healthcare providers and staff, because we need that. This is not just the last of my general surgery rotation. This is the end of my very first most clinical posting as a PharmD intern. I'm so excited and I experienced it so. I learned so many things. It is an unforgettable journey. If you are afraid you never learn or gain something new which you don't know, okay, if you are a PharmD student preparing for your first clinical posting, I want to say this: it's okay to feel overwhelmed at first. You might feel invisible or unsure, but slow up every day, observe, ask questions, and slowly you will find your place. Surgical specialty knowledge. Understand medications commonly used in general surgery. Ensure accurate medication lists. Ensure safe and effective medication use before, during and after surgery. Continuously learn and develop skills in clinical pharmacy practice. As I say goodbye to the general surgery ward, I take with me not just medical knowledge but valuable memories and confidence. I want to say this to you guys. I feel like not a student. Okay, I am a part of healthcare team. I am satisfied what I learned in a general surgery department. So I hope you like it. Thank you so much, guys, for watching my journey through the general surgery ward. If you are a PharmD internship or any medical student, I hope this gave you some insight into what real life clinical rotations feel like. Don't forget to like, comment, and subscribe for more hospital life content. Bye, guys.